This next generation NCLEX dropped on April 1st of this year, so just a little bit over a month ago. New nurses, this one is for you. I will give you 3 pieces of information you need to know if you plan on taking your boards anytime soon. What's happening is they're using your clinical judgment, your nursing judgment, and your decision-making skills to kind of make the exam adaptive to you. So they're using what is called CAP, C-A-P, Computer Adaptive Testing. So basically what that means is as you're taking your exam, they're giving you real nursing life scenarios, and you're expected to use your clinical decision-making as well as your judgment to answer those questions. Guidance and instruction using the nursing process model. Y'all know ADPIE, A-D-P-I-E. Assess, diagnose, plan, implement, and evaluate. Using those as like your solid foundation will get you through the next gen, I promise, because that is how you build your and measure your clinical judgment. There are a ton of videos and educational articles or what have you talking about ADPIE, so we will not go into that here. But if you just type in ADPIE or type in nursing process model, it will come up. You will be able to have everything you need to know if you just need a refresher, if you completely forgot what it means, or how to use your clinical judgment skills and what to do first for your 3 or 4 couplets or your 3 or 4 patients that you may have. Use that. I do encourage you to go to Google, maybe go to one of your old textbooks and just going through the ADPIE process again, just to make sure you have that content in like completely embedded in your brain, because you really can't answer questions without knowing what you should do first and what makes the most sense based on your patient population that's in front of you at the time. Number 2 is to get comfortable doing case studies. This new next gen, y'all, is gonna hone in on case studies a lot. So basically there will be 6 components or 6 areas or 6 items, if you will, that would display for each case study. So if you have a patient and they're presenting with shortness of breath and maybe a nosebleed, I don't know, shortness of breath and maybe a nosebleed that came out of nowhere. Well, each question or each bank of questions will really come from that patient scenario. So they won't just talk about this patient with the shortness of breath and nosebleed and then go into someone that's pregnant and, you know, just delivered a baby. Like, no. They're going to stay on that one case study, and they're going to kind of have an unfolding case study and build upon what you've learned, what you've deduced from the prior scenario or from the prior question, if you will. So they'll have a nurse's notes tab. They may have a lab or diagnostic results tab. They may have a vital signs tab. You will have some standalone test questions, that aren't a part of an actual case study or scenario. However, still get comfortable doing those case studies, because I promise they will be there in abundance. Use those apps. Use like NCLEX Mastery. I know some people use that. Some people might use an app that comes from the study session that they use. So I use HESI for me. I know other people use like ATI and things like that. So just use the tools that's provided to you guys. I want to say another one I've heard of is UWorld, but I'm not sure how well that worked. I used NCLEX Mastery when I was in school, and when I tell y'all, I probably did at least 50 questions a day throughout all of the systems, which you can imagine there were probably thousands of questions. So I probably did 50 questions a day. I'm not even kidding you. But, just use what tools you have that's provided for you. Ask your instructors or your professors and see what it is that they recommend as well. Point 3 is the testing structure. Now, in the past, you could take a minimum of 75 questions up to 250, I believe, and the system will literally just go blank when it's either deemed you're competent enough and you pass your boards, or you just need to study some more and you didn't pass. Now, the minimum is 85 questions, and it will go up to 150. Now, of course, we don't know how many questions you will receive at that point, because it's CAP. It's computerized adaptive What did I say it was? Cat. I said cap and it's cat.
Diamonds on me, go retire.
It's computer adaptive testing. It's cat, not cap. Anywho, so it will be based on your progress and how well or how not so well you're doing during your exam. So that's when it will shut off like norm. Now, there will be a couple categories as well. I'm going to read off my computer because I want to make sure I get this right. So you have safe and effective care environment. Under that, you have management of care as well as safety and infection control. Then you have health and promotion and maintenance, psychosocial integrity, physiological integrity, and under that you have basic care and comfort, reduction of risk potential, pharmacological and parenteral therapies, and then physiological adaptation. So 52 of those questions will come from those categories mentioned beforehand, but then you have 18 questions will come from the case study. So you have 3 case studies with 6 questions each, and they will have their own domains, if you will. Let me read that off for you. So case studies are item sets composed of 6 items that measure each of the 6 domains from the clinical judgment measurement model: recognizing cues, analyzing cues, prioritizing hypothesis, generating solutions, taking action, and evaluating outcome. So those questions will hit on these 6 item sets. You have to answer them in a group setting because it is based on that one scenario, that one case study. Assuming you only get 85 questions, your last 15 questions will be unscored, and that's because they want to see how well you do on those questions to see if they could use them in subsequent exams for people who's coming up behind you taking those exams. So we really don't know how many questions you'll get, but just know about 15 of them will not even be scored. So if you see something that's a little funky, they're just trying to test you to see if they can use it as a real test question for subsequent exams. Now, you will only have 5 hours to complete this. It might seem like a long time, but you want to make sure that you manage your time appropriately. I really hope this video was helpful to at least someone out there. If you really want to see more information on NCLEX, I want you to put a comment in the box below. Let me know what you would like to see, whether it's sample questions, practice questions, things like that, or just random things that you want to know about the NCLEX when I did it almost 10 years ago. So thank you so much for watching this video. I appreciate you. And don't forget to go to ifrn.org to support, as well as ifrn_org on Instagram. Thanks. Bye.